Good afternoon and welcome to this edition of This Week in Digital Health. I am your guest, Mike Doherty, and we are here with the Lithuanian team from Revolab. If you guys would introduce yourself, that would be great.
Hi, I'm Catherine. I'm co-founder of Revolab, and I'm thrilled to be here today.
My name is Ovidius. I'm also a co-founder and CEO, and thank you for inviting us to join you.
You're welcome. So you guys are working on a home blood test kit. And why is this so important in the current environment?
Yes, we are developing a platform that enables health testing from home. So we decided to implement this project because we think that traditional method where you have to go into a clinic or a lab and a nurse takes blood from vein, it just is a lot of friction for a user to go through different hurdles. So you need to travel, you need to register, you need to wait in line, you need to wait for your test results. So we wanted to make it as simple, as easy as possible with home testing. So you can draw a sample at home or work whenever it's convenient for you. And we basically manage the rest. We pick up the sample, deliver it to a partner laboratory for analysis, and we provide user-friendly mobile dashboard for tracking your test results in one place in digital format. So we think it's consumers, they are shifting more and more to self-service based solutions versus something that you need to sort of lab-centric solution, I would say.
I'll just add that I have some experience with lab diagnostic with my previous jobs. And what I have noticed that people tend to postpone all the tests because, you know, it's not the prettiest thing that you can do every day. So you always think of some excuses, why it's not today, why it's Monday, why it's next month, and so on and so on. And all this COVID situation, people got even more excuses to skip testing, you know, and all those diseases which could be diagnosed at early stages, they are now, you know, they can be diagnosed at later stages, which when they are really dangerous. So we think we could really make a big change here and like help people be more disciplined and take care of themselves properly.
And my understanding is that the platform supports 30 or so different types of blood tests. Is that correct?
Yeah, even more. Actually, we are expanding our spectrum of tests as we go because we can see what audience is about, and it depends on the season and so on. So yeah, and we're expanding. So I think in the end of the day we will be able to do everything which could be done from finger prick.
So I'm sorry, sir. Go ahead.
Add that the big change is that our product is based on capillary blood, finger prick sample, which is some tests they will still require you to go to lab and have your sample taken, venal blood for serious diseases. That is still, I think, that will remain. It will remain a standard. But what we are focusing on is just prevention, so early detection of health risks, and tracking things like how your lifestyle or how your diet affects your health. And we think we developed a simple way to do it. So there's a lot of applications out there who actually do it based on things like your workout routine or something that exercise, yeah. But they're using kind of mechanical data, and what we bring, the value that we bring, we use real personal test results, lab grade test results. And our software also provides interpretation, what those test results mean for you. Are there any risks that you should be aware of? So I think we're also adding value here, result interpretation.
And where's the distinction between providing the feedback with regard to the results versus where you would provide the results to a doctor to sort of counsel someone with regard to care options?
Yeah, good question. Maybe Catherine, you are. Could you answer that?
Yeah, if I got it right, yeah, you're asking if we have any consultations available right now. So
no, actually, let me just clarify. What I'm asking is, some tests will typically go back to the medical care provider in order to explain to you the results, right?
Yeah.
So, if somebody were to take an HIV test, we wouldn't just mail you the result in the mail, right? We'd want to provide that information in an environment where we can offer you additional support, where we can offer you counseling. So I was asking, how do you differentiate when you supply the results versus when you forward the results to care provider?
Yeah, I got it now. Thank you. So if we see any red flags or let's say yellow flag, we always, what we provide is we recommend the person to go to his or her general practitioner and discuss the results with them. So yeah, we don't diagnose, we don't provide any diagnosis. If it's minor, some out of range things, we can, provide some recommendation based on our general practitioner review. But if it's something, deeper, more serious, we always recommend the person to go and see his doctor. That's what we do.
For diagnosis, to diagnose disease and further options.
Right, because very often we'll get information back, and because we don't really clearly understand it or understand the metrics, we may freak out when the information may be just, like you said, a yellow flag and not necessarily escalating to a red flag. So that's very often why, a lot of this information is conveyed by healthcare providers to ensure that, they can guide you based on these results where you should go and what your next option should be. So you're able to do these tests from a pinprick, correct?
Yeah. Okay. Actually, it's not only blood samples we do. We also work with urine for STDs, and we work with saliva for cortisol, stress hormone, and for PCR COVID.
And so you give the home user all the means to capture whatever they need, sample they need to sample.
Yeah, we provide collection kit and all instructions, all the guidelines. We have our support hotline. So if you have any questions or you're maybe too stressed to do it, you can call. Our nurse would guide you through the process. So it would be smooth and easy for you. And and then you call the courier and somebody comes to pick your sample up, and you don't need to leave, your comfort zone for that, whether it's your home or your office or whatsoever, which is, it's also actually really nice solution. And what we see now, that usually moms with small babies, they use our services a lot because they don't want to go anywhere with the baby on the hands. Or of course, people who have limitations of the mobility.
And can you sort of elaborate on what does the digital platform offer?
So it's a platform where you create your profile. It's mobile application, and it has functionality for ordering health tests. And once analysis is done, it has graphical interface to show the results, explain the results, and we are implementing a solution where you can actually follow up with a medical doctor, with like have human in the loop if you want to have online consultation. So it's also will be part of our platform. So telemedicine.
And how do people find out about this? Is this recommended by their healthcare provider, or where do they learn about the platform?
Well, now it's our marketing forces and word of mouth, of course. So people, our happy users are happy to share those experiences with their friends. And of course, we work, also on social media. So we try to spread our word as we can.
And the early adopters, have they been healthcare conscious? Have they been a specific disease group? Where do you see that the people come from that are looking for these types of services?
It depends on the test, I would say. So first, as I mentioned before, it's young moms with small children, so not with specific disease, just, regular testing. Responsible mummies, it's really good audience because you have to get yourself tested for sure, especially when you're a mom, you have, to be really in a good fit. It's first group. And of course, people who would go to lab as we speak now. I mean, they would do that every few months. They also would rather switch to our service because they don't have to go anywhere. Travelers is also a big group of our clients because they don't now to fly somewhere, you need a COVID PCR test, and you need also to go somewhere and get this unpleasant procedure of swab, and we have an alternative when you don't have to go anywhere and you just collect your saliva, which is not, quite a pleasant experience. So I would say this to 3 big groups now.
And in the COVID testing, like that testing could be frequent. For instance, I was at a conference this past week, and they were insisting that if you were at the conference for more than 3 days, that you got retested, right? So that the need for it happened to be a 4-day conference, so you were getting tested at a minimum of twice. You know what I mean? In order to participate in a 4-day conference.
Yeah, it's the same in Lithuania. You need to get tested if you want to go to a wedding or some, big gathering of people. It's the same here.
And have you seen a big demand for COVID testing through the program?
Yeah, actually, it was the biggest for PCRs.
Okay.
Now it's decreasing a bit since, world is opening more and more.
And what's the key differentiator? The fact that you handle all the logistics when you compare yourselves to other companies that are doing this type of work?
I would say that we try to differentiate by providing sort of a 360-degree service. So you can order everything. We manage logistics. We have certified lab partners. We have doctors who help with interpretation. So it's sort of like a holistic approach. So we handle the whole cycle up to the point if you need like already go in the clinic if there is a health risk. But
do you have the telehealth capabilities, or is that something you're planning to add?
It's in our roadmap, and we will be adding that this year.
Okay, but so not currently, but it's something that you hope to expand to and do.
Correct. I think that based on user feedback, it's something they are very much interested in.
Yeah, I mean, I would think there needs to be, again, the information without some sort of interpretation, right? Especially for the layperson, doesn't necessarily help, or could make it worse as people don't understand their results. I remember in years past, I would get results and I'd be like, is that a good thing or a bad thing? Like I didn't, you would get a positive result and I'm like, I don't know what that means.
Well, that's actually this we do by default. So we provide you with the message if it's good thing or bad thing. That's we know for sure.
So at least if you're in the clear or whether or not you need to go to sleep.
Exactly. At least you know if you should worry about it or you should not. Yeah, that's what we do. That's what we saw as a big problem, since people usually they just get this PDF from the lab and they can't read it at all because
Right.
it's numbers and it's ranges and you don't know if you are,
Yeah, I mean, we don't understand what any of that means. I don't know if that's average or good or within range, right? Exactly. You need someone to interpret that typically.
Exactly.
And
Yeah.
just bear in mind that we started just 12 months ago. So we have like some rudimentary analytics now, but I think it's huge opportunity to use artificial intelligence to make these interpretations more and more sophisticated.
So you indicated that you had started 12 months ago. Is this your first startup or have you done startups before?
Mine is first, and the videos is quite experienced one. He will speak.
Yeah, in my case, it's a third startup.
Okay.
I have founded and co-founded two startups before in travel tech. And Ekaterina?
And what made you go to health tech or this platform?
Well, Ekaterina, the co-founder, she comes from healthcare industry, and it's just, I think, the timing and the opportunities we think it's huge, and the shift that is taking place in healthcare from traditional model where you go into the clinic and have a chat with your physician to various remote and self-care options that are becoming available because of the new technology.
So as a serial entrepreneur, I know that you know how important it is that all the different support that you need in order to get a venture launched. I know that I believe that you've worked with EIT. Can you tell us about that?
Yes, we've been selected to participate in EIT Digital Program last year. So we graduated and we actually won the prize that was awarded 25,000 euros. So it allowed us to develop our MVP, and with that we've been able to secure further funding. We just recently closed investment 300,000 euros pre-seed investment round from a Lithuanian company called KiloHealth. They are in health tech as well. It's just much bigger. They are already scaling across EU and US.
And beyond the money from EIT, can you tell us a little bit what the program helped you do or accomplish?
It was, first of all, I think, support from various experts and mentors on questions like fundraising, pitching, the whole range of legal questions, technical questions. So things that founders, they have challenges, especially when you're starting and is short on resources. So I think that support is very valuable. It's
critical, actually, and I would also add that maybe the emotional part of it, it's really inspiring. Then you have somebody to believe in you, because you're full of doubts and you don't know if it's going to work or not. And when you see that a bunch of really high-level professionals do believe in you, it really kicks you in a good way.
Yeah, and what's good about EIT Digital is that process, selection process is really clear and simple.
And smooth, yeah.
Like with a lot of, like here in Lithuania, we have some government incubators to support startups, but it's just to apply, it takes,
ages. Yeah.
Yeah, we work with a lot of people with regard to the Horizon program. And, we tell them, this is a minimum of 6 months, to just apply.
And that's crazy.
Yeah.
Yeah, it's crazy. You can forget about your idea.
I mean, it's a great program. There's lots of money available, but it's a long, arduous process. You have to, and you have to sort of prepare yourself that, this is something you will do while you're working on other things, because,
Right.
it's going to take 6
No,
months
if
to a
you
year.
are a mature company, maybe, well, yeah, you can, but if you're just starting like early stage,
Yeah, it's not a quick fix, and you won't get money tomorrow, so, but, it's
well,
one of those programs that
EIT
is
Digital,
long-term.
really clear, simple process. You prepare a pitch deck, you have several online meetings, and if you're lucky, I mean, if you have a good idea with good potential.
So where do you go from here? You have the MVP. What are you going to be working on in the next year or so?
A few things. So we just got our blood collection kit certified for EU markets, registered as in vitro diagnostic medical device. So we've been cleared to offer it in all 27 EU countries. So I think with the funding we have, we are going to maybe go outside Lithuania and test it in one, let's call it a high potential market, one of the bigger EU markets.
Sounds like Germany.
Yeah, and we will run some experiments with new products. Maybe Katerina, could you talk a bit about that?
Now, currently, we are implementing artificial intelligence as a solution for our test interpretation. So we are making a product so a person could upload his test report from any other lab he was tested previously and track his results. So he would have some kind of wallet of his health, state, and we could track, and he could track and see you, for example, you have high cholesterol, yeah. So, and it's, it's a problem, you need to solve it. So you start and apply new diet. So you want to see how you're doing, yeah, because you eat well and so on. So you can track and see how it's going, if it's helping or it's not. So we are working on this now. We are also implementing fertility issue solving product for women to track the ovulation and to know this very precise time for optimal conception. It also with the help of artificial intelligence. So we could help more couples to have the baby.
And how do they access the platform? Is this an app? Do they sign on to the internet? How would they access the platform?
Yeah, we have app and we have application both on Google Play and on Apple Store.
Okay.
Revolab help, please download it. We would be
well, it's only in Lithuanian store at the moment, but yeah, it's out there.
But the plan is to expand into different EU countries for now.
Correct. Yeah. We think that these markets, they are kind of underserved in terms of remote blood sampling. Markets like United States, there are several companies already well established, first movers, such as, for example, Revolab Health. It just became a unicorn, I think. They raised D-series funding just last month. So in US, consumer behavior is really shifting from on-site physical, let's say, testing to remote self-service. They're becoming mainstream thing.
And what about the payers? What will they reimburse for this? Do they like this? What is the response from the payers?
Sorry, response from who?
The insurance companies or the healthcare?
So we have one insurance company as a partner, Big Insurance in Lithuania, and I think we'll have other insurance companies to join. But yeah, they are keen on working with us. And yeah, so if you have private insurance already today, you can.
Yeah, but I mean, we definitely, one of the key drivers for success will be whether or not the payers will be willing to reimburse this, right? Because
Yes.
that will allow greater adoption. Some people have private insurance, but you really want to get it to the masses, right?
Yeah, I think it will take some time to to convince, but it's a win-win situation with this frequent testing. I mean, the government, they encourage people to get tested. They have special programs just so you go into the clinic and have your heart health tested for free, and it's only like 20% adoption rate, even if it's free, because people, they just delay it, or they, until it becomes serious risk. So we offer like alternative that you don't really have to go anywhere. You can do it from your home.
Yeah, I mean, one of the ways to get the payers involved is sort of prove the value care proposition. And I think that Catherine alluded to this earlier, that by testing more often and more frequently, right, then we have a greater chance of an earlier diagnostic, which gives us better opportunities to, come up with a care plan that allows for a better outcome. So when you're having the dialogue with the payers, what you want to emphasize is, this earlier intervention, because then we can have a greater impact on the care outcomes.
Sure.
So I would stress that when you're having that dialogue with the payers, because the payers will ultimately be the ones that will drive this, especially in your expansion. Because in order to get to people, it needs to be reimbursed.
Sure.
Great. Well, we very much appreciate your time today. It was nice to learn about Revolab and some of the work you're doing. We look forward to checking in a couple months and see how it's going. We wish you the best of luck. We're glad to hear that programs like EIT have supported you, and we look forward to meeting you again in the future.
Thank you.
Thank you.
Well, bye-bye. Take care.